Good afternoon and welcome to the National Cancer Institute's Facebook Live event in honor of Childhood Cancer Awareness Month. September is Childhood Cancer Awareness Month, when we all raise the visibility for the many children and young people who are dealing with a cancer diagnosis. My name is Jenny Luca and I am the CEO at the Children's Inn at NIH. We are coming to you today from the Teen Room at the Children's Inn at NIH, and today we will be talking about pediatric cancer treatment, clinical trials, and this unique partnership that we have that really supports the whole family when they're undergoing cancer treatment. I am pleased to be joined by the Chief of the Pediatric Oncology Branch, Dr. Brigitte Wiedemann.
Yes, hi, I'm Brigitte Wiedemann, and as Jenny already pointed out, I'm the Chief of NCI's Pediatric Oncology Branch. We work closely with the Children's Inn in providing the best care to patients that come to the NIH to participate in clinical trials.
We are so excited to be on Facebook Live and to interact with all of you viewers who are watching us, and we invite you to submit your on-topic questions. You just need to write your question in the comments section, and we will try to get to them towards the end of the event. So let's get started. Dr. Wiedemann, let's start with you telling our viewers a little bit more about the mission of the Pediatric Oncology Branch and maybe about you and the team that you work with.
Yeah, so the Pediatric Oncology Branch is a group of clinicians, of researchers, both basic researchers in the lab and in the clinic, and of a number of other healthcare professionals, all with the joint goal of improving survival and the quality of life of children and young adults with cancers and other rare tumors. We do this on the NIH campus, which is in Bethesda, Maryland, right outside of Washington, D.C., on a large research campus, and our clinical research is conducted at the NIH Clinical Center. This is the largest research hospital in the United States, and we can bring patients from all over the world, and for sure from all over the United States, to participate in clinical trials that may benefit them. An important aspect, Jenny, I think, is to mention that as this is a government-sponsored facility, patients can get here without being charged for the travel to come here, and none of the treatments that are provided or of the diagnostic tests will be charged to patients and their families. With this comes the mandate to do world-class clinical research and be focused on diseases where there is no curative treatment option or where there is no standard therapy.
And can you tell us a little bit more about what is meant when we say clinical trials? I think that there are some maybe fears or even myths around what is a clinical trial, when actually we know what a positive experience it can be for somebody that's participating in a clinical trial.
So in a few words, a clinical trial is an experiment that is done in humans, and because it is done in humans, it has to be extremely well designed and thought through. Actually, in children with cancers, almost every child is enrolled at the time of diagnosis in a clinical trial, which is wonderful because through this we have learned to cure many more cancers than we have done in patients that are adults. There are clinical trials that provide what we call standard therapy, and this is the best known therapy to date. But then when there are children where the best standard therapy does not work, there are earlier clinical trials that are more, as we call it, experimental or investigational, where we test new medicines, where there's a good scientific rationale to take it into humans, but it is an experiment that is done carefully by evaluating patients on new medicines, and this is what we do here at the NIH. I think it's very important for patients to know that all of the trials are done with an intent to be safe. That is the most important aspect, and hopefully to benefit patients. But for very early trials, we don't know that it would benefit.
Right.
So Jenny, can you tell me a little bit about what the Children's Inn does and how it helps us do clinical trials in patients?
Sure. The Children's Inn, so while Dr. Wiedemann explained the NCI and the NIH being federal and being government funded, The Children's Inn is a nonprofit organization, but we're located on the campus of the NIH. So we don't receive government funding, although we are a partner to the government. And our mission is to provide lodging and support services to more than 1,700 families who come each year to participate in these cutting-edge clinical trials. And we see our role as being twofold: to take care of all the little things for families so they don't need to worry about the cost of lodging or the cost of food, or even if their child will receive educational services while they're here. We do all of this so that they can really focus on the medical treatment while they're here. And just like the treatment at the NIH, the services that they receive from the Children's Inn are also free of charge.
This is wonderful. Can you maybe give like one concrete example of what type of patients you bring her, for how long they are here, and how you help them best participate
Sure.
in trials?
So 1,700 families, and they're participating in 15 of the institutes at the NIH, so 15 that provide clinical trials for pediatric patients. About 30% of our kids are patients at the NCI. So we see and their range in age from infant all the way through 30 years old. And they come, as you just said, with really devastating diagnoses. By the time they get to the Children's Inn and to the NIH, they've often exhausted their family finances, or exhausted emotionally, as the standard treatments have failed them. But they come with such hope, and I think they're met with hope by you and your team and the clinicians who are so focused and driven and passionate about finding cures. And at the end, we continue to fuel that hope and make sure that they are supported while they're here.
Thank you. That was very helpful.
And I'm Jenny Luca. I'm the CEO at the Children's Inn. I'm talking today with Dr. Brigitte Wiedemann. We're coming to you in our first Facebook Live event in honor of Childhood Cancer Awareness Month, and we're very excited that you've all tuned in today. We hope you will submit some questions to us that we will hopefully get to later in the event. So, Dr. Wiedemann, can you tell me a little bit more about what the pediatric oncology branch is focusing on today? What specific tumors or cancers or types of treatment a patient might receive if they're looking to participate in a clinical trial here?
Yeah, so we focus on treatment of a variety of tumors in children and young adults. This includes leukemias, and we've made some great strides in the development of effective treatments for leukemias that a few years ago were simply not there. And these are immunotherapy clinical trials where patients come and actually stay for quite substantial time, potentially at the pediatric oncology branch in the clinical center, but also at the Children's Inn. We've had great successes with this very novel therapy and bring patients from all over the country for this. We have patients that come with brain tumors. A focus that we have is on diffuse intrinsic pontine gliomas. We have a focus on solid tumors, in particular sarcomas. And we have a focus on very, very rare tumors that many oncologists do never see, or maybe once or twice in their life. And in my mind, this has been one of the great assets of the clinical center and of the Children's Inn, because the patients with these very rare tumors that come to us will meet not only at the clinical center, but at the Children's Inn, where the families meet and they get to know each other, and sometimes for the first time in their life see a patient with a similar diagnosis. The trials that we have are chemotherapy trials, they are precision therapy trials where we give targeted medicines, and then we have immunotherapy trials. In addition, we have trials that study what we call the natural history of a disease for very, very rare tumors, to actually better understand what are the problems that patients have and how does the disease manifest.
You make such a good point about the special connection that families make when they finally get to meet another family that has the same rare disease. Because it's really, in a world of technology, I think they're connecting more through social media and those kinds of interactions. But I think there's nothing like having some FaceTime with a family. And I think that's another way that the Children's Inn is able to support your families as well, to provide these spaces where they can really come together and offer each other mutual support and maybe compare notes about what's happening in their world, and then maybe take it back home, and those families become part of their network of support. From your perspective, can you talk a little bit more about what you hear from families about the way the Inn has been able to have an impact on your research?
Oh, it's tremendous. Without the Children's Inn, we really couldn't do the research that we do. I think that's point blank. Patients that come here need to stay here sometimes for weeks, certainly for days. The Children's Inn provides the home away from home and allows us to see patients and carefully monitor them. We really feel like we're partners with patients in this, and our ability to see and monitor the patients carefully allows us to conduct the clinical trials in the way that we should conduct them. At the same time, the patients feel that they have a very comfortable place to retreat to after sometimes days long of testing at the clinical center. They can connect and sometimes come back with really good ideas to us of what we should do next. So I feel the Children's Inn is a very important partner in conducting the clinical trials that we do.
Yeah, and I think the fact that we both are able to offer these services free of charge takes a lot of burden off of patients. And I know that at the Children's Inn, I get to meet families every day that, most of these families, as you just said, have been to many, many hospitals, and there's great institutions in our world, but I hear day in and day out about the level of care at the NIH and the NCI just being so different from anything anywhere else. Can you talk a little bit about that? I think it's the research component of what you do.
Yeah, I do think one aspect is we try to do cutting-edge, world-class research. We don't want to put a patient on a clinical trial unless there's an excellent scientific rationale for this. And we conduct these clinical trials very seriously, but at the same time, we want to learn about the family, and we want to help them in every other way possible. And just like the Children's Inn here, we have other resources. We have psychologists, we have a pain and palliative care service. And given that patients are here, we try to expose them and give them opportunities to get help that is outside of the clinical trial. We do develop close relationships to our patients, and it is science, but we do this with our hearts, and I think patients feel this.
I think you're absolutely right about that, and I also believe that the model of care here that we have, which is this really unique public-private partnership, it's not often that you see a nonprofit organization working so closely with a public institution, and I think we've become a model for other organizations in other places, and the families, while we are two separate institutions, I think it's actually quite seamless for families.
Yeah, and I do know you come to many of our rounds so that you see what's going on. You have an anticipation of where you have to focus your efforts on, which has been wonderful. Yeah,
it's been an incredible journey, and I think it's because we're led by the families, and the families know that they are making a major contribution to research. So hopefully they are participating in a treatment that is going to help them today, but they know it's going to help generations to come. Can you speak to some of the major advancements that you've seen while you've been here? And maybe you can even, if I know you're quite humble, but if you would speak to your own lab and many of the patients that we see here and support, and there's been some significant advancements there.
Yeah, so I think maybe the two things I would like to highlight that are really exciting is the advances in the treatment for leukemias. When children have leukemia and the leukemia comes back, in spite of 90% of kids potentially being cured, the ones that don't get cured have a very poor outcome. And just over the past few years, and this is not my research, but research conducted by Dr. Fry and Dr. Shah at the pediatric oncology branch, they've developed immunotherapy trials with what we call CAR T-cell therapy, where the complete remission rates in kids that come with refractory disease are about 70-75%, and this is phenomenal. This is something that a few years ago we would not have thought of. Does this always mean cure? It doesn't, but it can in some cases, and it also gives kids an outstanding quality of life once they get into remission, and potentially the option for other targeted therapies, including the chance to get a successful bone marrow transplant. And I believe there's a lot of hope that we can move this to other tumors, to other types of leukemias, and to solid tumors, where we're still struggling to make this same leap that we have made forward for leukemias.
Why? Why
It's a lot more difficult than leukemias that are in the bloodstream, and we have to identify targets that are only present on the tumor but not on healthy tissues. That is one of the challenges. But I'm convinced we'll make progress. The other example from my own research is a disease called neurofibromatosis type 1. It's a tumor predisposition syndrome. It happens frequently in 1 in 3,000 people. And the patients that we see here at the Children's Inn and at the NIH are kids that develop what we call plexiform neurofibromas, large tumors that can appear in any part of the body. They can be very disfiguring, cause pain and functional impairment. And we've been conducting clinical trials, and you're right, one of the clinical trials with a MEK inhibitor, that's a medicine taken by mouse twice a day, is really showing substantial promise in that these tumors shrink. And very importantly, patients have less pain. They have improvement in function, so that's a substantial advancement in an area that would have been difficult to study at other places.
Which is just amazing, and we get to see those patients when they come back from you every day, and what we try to do, of course, is give kids the opportunity to just be kids. These are kids that have been through far more than most adults in their life, and especially those children who we see that their deformities or their disease is obvious, because you can see the deformities, and I think when they're back at home and in their schools, it's difficult to make connections with peers or participate in sports or just do what every other kid should be doing. And so we work very hard, as you know, at the Children's Inn to really give those kids those opportunities to just be kids, whether it's going to the baseball game or
and they love that.
Participating in programs here. And again, it's just an example, I think, of how we come together. And then we try to make it so great so then they want to come back so you can continue to do your research.
Absolutely, and they do come back. Yeah, absolutely. I agree. Would it be time to go and move to questions?
Sure. Do we have
from
any
viewers?
questions coming in? Well, we're waiting for our questions to come in. We will...
Maybe, Jenny, while we're waiting for questions, one aspect I think it might be really interesting for viewers is to see how they can get more information about the Children's Inn. Can they go on websites and find out? Or
great question. So if you'd like more information about the Children's Inn, we have a website, childrensinn.org. And there are many ways to get involved with the inn. So if you have a child that potentially, or a family that would stay at the inn, those would come through your medical team. So we'll talk in a minute about how they would find you. But then our website's going to give you more information about how to support the inn, whether that's through a financial way or even volunteering. We have many ways, we have many needs actually for our families, and some of the more fun ways that people like to get involved are to provide dinners for families or to help with tutoring and our educational services. Sometimes companies come in and do some fun things with the families as well. I'm glad you asked that question. It makes me think, how do families find you? How do they know about the clinical trials?
Many families actually contact us directly for clinical trials, and we have referrals by doctors, and we have many patients that call us directly, which is interesting. I think the internet has really changed how patients find us.
So does the family typically, they've already been diagnosed usually with a cancer because of the nature of the clinical trials, so they go to clinicaltrials.gov, right?
I assume it's amazing how families find what is important for their kids. Moms and dads are wonderful. They will go, and many times are more informed than sometimes the best of us are with everything that's going on in the world.
Okay. All right. Well, I think we have a question, and I think this question is for you. How is the safety of participants in clinical trials protected?
Great question. We do early clinical trials. This means medicines that sometimes are given for the very first time to a child, and sometimes for the very first time to a human, let alone being a child. And the safety is very, very high. That doesn't mean that some of the patients would get sick, especially the immunotherapy trials that I just talked about. we actually expect patients to get sick, so that they may even have to go for a few days to the intensive care unit.
Right.
But we've been able to manage this in a very safe environment. And again, here it shows having the children's in so that families can be here for support for their patients is very important. The rate of serious complications that are irreversible is very, very small. But it is something that we take extremely seriously.
That's very positive. It makes me think also, the Inn is always working hard to support what you're doing, and one of the ways we've done that in the past few years are for some of those patients who through their treatments get some of the antibiotic resistant infections like MRSA and C. diff. We've been able to renovate some of our spaces to support those patients.
Absolutely.
So
and you have isolation rooms
and other
isolation
rooms.
Yes.
And I remember when we were piloting that, we were told, no way, that'll never work in an organization when you have other healthy patients, but it's worked beautifully, and I think families are able to stay with their family members as well.
I see another question coming up, and that's an interesting one. I would like to hear too, because I don't see it. What does a typical day for kids at the Children's Inn look like, and for their families?
Sure, it's a great question. So if you can kind of visualize the Children's Inn, it's almost a boutique hotel with really fun spaces. As you can see our background here, every space in the inn or outside of the inn is really carefully designed for kids and for families. And so families wake up, they have to get across the street, and we say across the street for the viewers, the clinical center, the hospital where they're receiving treatment is directly across the street. And they eat breakfast with their families. The Children's Inn provides a little breakfast. And the most fun part about the morning, though, that I just want to share with our viewers is a really neat program we have where you can actually get involved, and it's called Thoughtful Treasures. So
I love it.
So every child at the inn, their siblings, and our therapy dog Zilly gets a little prize in their mailbox every day. And it sounds so simple, but our families say, our caregivers say, it's what gets them downstairs and across the street to you. It's kind of
I've experienced that.
You have?
Oh, absolutely. Yeah, the kids definitely talk about that.
Yeah, it's fun.
Yeah.
And then they're really long days with you, as you know, lots of tests and treatments and studies. So when they come back to us, we go bold and we go big, and we try to make sure we have
Bingo.
lots of we do everything from food and fun to even special programs for teens or young adults or even moms and dads, and then just a lot of fun. It's almost we work hard to distract everyone for just a few hours from everything that they're going through.
It's wonderful.
Yeah. This is a great question. I think this is actually an excellent question, because you hear a lot that usually when a child is diagnosed, it's at home, and it's probably with their pediatrician. And I think that initial diagnosis causes a real rush of emotions and everything that goes with it. And so I love this question about when and how should a family start to talk to their doctor at home about clinical trials?
I think doctors probably start talking about this immediately. For pediatric patients, it is standard to enroll in clinical trials, and I feel families grasp the concept of this very quickly. For most of the newly diagnosed patients, the clinical trial is known. We know this is the best clinical trial available, most commonly through the Children's Oncology Group. What is really hard is when the tumor comes back, or if there are no good treatment options, and that's when families seek out and talk to the doctors, and we get many calls from families saying, hey, this is the diagnosis, do you have anything, do I qualify for this clinical trial? We try to answer as completely as possible. Sometimes that requires getting information about how well the patient is, what the disease status is. We always want to make sure the patient gets the best treatment. We would never prioritize an experimental trial over medicines that have a better chance of working that patients can get at the outside of here.
Right.
I feel the more involved patients are, that means the kids, the adolescents, young adults, and the parents, the better it is for the ultimate participation in clinical trials. The more they understand of the clinical trial, the better we can make this happen, and the input from the patients from clinical trials helps us design better clinical trials.
That's so interesting. So have you seen a change over time with parents and patients being I don't know if the right word is more astute, but more aware that it's so interesting to me. They already know to ask
Absolutely.
about clinical trials. Has that changed over time?
I would think so, yes. And I feel we as doctors have learned too. In the past, you think this is the doctor, this is the patient, and now we know we are a team. And we listen to the patient, and ideally we want to get the patient engaged in thinking, how do we do the next clinical trial? Not to identify what the medicine is, but patients may say, this is completely irrational what you're doing here. You cannot do a blood test every other day,
Right.
because it's too much. There are things that patients think of that we wouldn't think
Yeah.
of. I feel parents are usually very good advocates for their kids.
Yes.
And the kids too can speak up.
Yeah.
So that has changed. I agree with you.
Yeah, that's so interesting. And parents also and families really help us with our programs here. That's where we take our advice from the parents about what their needs are at any one time. And we've seen some of those needs change over time too. And I think also for those families who are traveling to come here to the NIH, that can put an enormous amount of stress on a family.
Oh, absolutely.
Especially if they have to come back multiple times or stay for a long period of time. And maybe that's where the inn comes in also to help those patients.
That fits really good with the next question. How long do
Yeah.
actually families stay typically at the children's inn for?
Well, it's dependent upon the child's treatment. The average length of stay for a family is usually about 3 to 7 days, but we have families coming from all around the United States, and I think we're up to maybe 94 countries. So for families that are close by, they can go back and forth between their treatments, and that's really where that 3 to 7 days plays in. But for families coming from other countries or have a very difficult or complex treatment like a bone marrow transplant where they're required to stay for an extended period of time, we see families here for 4 or 6 months or even a year or more. And for those families, especially coming to us from other countries, they're often leaving other family members behind. A mom might come. You see those patients. And so that's tough, and we try to work hard to support their needs as well. This is definitely a question for you. How close are we to finding age-appropriate treatments for teens with Hodgkin's lymphoma? I'm having trouble seeing the rest of I'm not seeing the rest of the question.
Yeah. So Hodgkin's lymphoma is a disorder where there's actually many patients will actually...
No, to prevent the long-term effects of treatment.
Oh, that's an excellent question. Because Hodgkin's lymphoma is a disease where cure rates are really very high. However, it comes with toxicity. And there is a lot that needs to be done to develop treatments that are just as effective as the treatments that we have that minimize the toxicity. I cannot tell you, unfortunately, how long this will take, but we're focusing on this very much, and the immunotherapy approaches that we're developing might be one clue to this, because those would really activate the body's own immune system and could potentially have many fewer side effects down the road than the chemotherapy and radiation therapy that we have used in the past. So it's something that we really very much pay attention to here as well.
And are the long-term effects for Hodgkin's lymphoma similar to other cancers? I know there's a lot of research being done on long-term effects.
It depends on the location of the tumor. One of the important aspects of the side effects from radiation, where you can develop second malignancies, such as if you have radiation of the mediastinum, developing breast cancer. It can be effect on heart function. So it depends some on the treatment that you got, but it is the effect of the chemotherapy and of the radiation that we mostly fear.
I think that was such a great question. We certainly see those families at the inn as well, that a cancer diagnosis isn't just diagnosis and it isn't just treatment or even just cure, but for many families or many people, it's a lifelong disease that they have to continue to pay attention to. The next question for us is, who pays for clinical trials?
It's very, very costly to do clinical trials, actually, and we're in a very fortunate position here at the NIH that if we have a brilliant idea, that we can take it from the bench in the lab to the bedside very quickly, because we are funded by the government, so taxpayers really pay for this. We can move this very quickly. We don't have to get outside funding. We can do this with the funding we have at a cost that is sponsored and paid for by the government, but
Right.
the ability of us to have this stable funding allows us to move really quickly. And then to go back, some clinical trials are sponsored by the drug companies that develop these new medicines. There are many company-sponsored clinical trials. These are typically large clinical trials.
Right.
There are many other places, the Children's Oncology Group that conducts clinical trials. And again, the government is very important in supporting these efforts. There's other sources of funding. There's philanthropy. There are other institutions like St. Jude. They do a phenomenal job
Right.
with their clinical trials. What really sets us apart here, I think, is the freedom to go quickly from bench to bedside and
Right.
back to take on high-risk projects, because we don't have to apply for the next grant cycle. We don't have to get money and secure it. We have to do outstanding research and deliver on
Yeah.
the promises that we make.
And I think our government and our people have continued to really support medical research and have seen the work that's happening here at the NIH and seen these major advancements.
Yeah.
And I know there's lots happening in not only childhood illness, but even Alzheimer's and
Yeah.
other big illnesses as well that's happening right here on this
Yeah.
campus. So I think it's important to point out that the government pays for it, and that's why when families come, one of the first, or something that they report being surprised about or feels a little bit strange is there's no exchange of money when they're
Yeah.
here at
Yeah.
all at the Children's
Absolutely.
Inn or at the NCI. It's literally participating in medical treatment and coming back to the inn, and there's no wallets coming out.
That's
we're
right.
supporting them,
That's
but
right.
they are also participating in the research and helping us. They're part of this partnership,
Yeah.
the patients bringing new cures and treatments to the rest of humanity.
Yeah.
So it truly is a partnership. The next question is, do patients stay inpatient at the clinical center?
Yes, they do. And while most of the treatments that I do, patients will sleep at the Children's Inn because
Right.
they're outpatient treatments, and more we develop treatments that are outpatient. The treatments, for example, with the immunotherapy or bone marrow transplant do require inpatient stay. This is on the first floor of the clinical center. It's called One Northwest. We have fantastic nurses, a wonderful inpatient unit, and it's so close to the Children's Inn. So if a patient stays inpatient and maybe doesn't like the hospital food, the family can come down here and cook, and they can bring the meal up. Or
Right.
if there's a dinner at the Children's Inn, they can get food.
Yeah.
So patients are inpatient, sometimes for a long time, if their immune system is low, if their counts are low, if they have a fever and infections. But we do try to get our patients as quickly as possible to the outpatient side. Sometimes we start, and this is again luxury that we have this here, with an out-on pass, which you
Right.
wouldn't see at the outside. We say, okay, you can show us that you can do this. You can go tonight and you come back tomorrow morning.
Yeah.
If you have a fever tonight, you just come back to the inpatient side.
Yeah.
That is wonderful, to let patients go, and then we'll discharge them subsequently.
Yeah, it's funny. Just last week we saw one of your patients. We really saw this at work. One of your patients, who I think was having a hard time in the hospital. It's hard to be overnight in the hospital.
Yes.
You're woken up multiple times, and we have a therapy dog, Zilly, and he asked if he could walk Zilly from the from the clinical center back to the Children's Inn, and he did, and it wasn't easy. He was very
Yeah.
weak, and his mom reported just it changed his whole outlook
Absolutely.
on his treatment and his prognosis and how he was really going to attack this cancer. So there's a lot to be said for families having opportunities to refresh and to relax and to connect with other people.
And this fits really perfectly with the last question, which says, do only parents come to the Children's Inn and the NIH?
Yeah, no, I think that's really, what a great last question, because that's the model of care, is that this partnership is meant to support the whole family, whoever is in that family.
Yeah.
And that we truly believe that when a patient is able to receive treatment with their family surrounding them, it leads to better outcomes. So no, the whole family can stay at the Children's Inn. We have special programs for their siblings. It's hard to be the sibling of a sick child. You lose your childhood a little bit too. So we try to really direct some important programs to them and to their parents. And if there's a sibling that's in college, we even try to help continue those sort of college courses, or if a patient wants college prep. So no, the inn is for the whole family, and I think that's a really important part of the care.
Yeah, I agree. I think this was the last question. I would like to take the time to thank you all who watched this Facebook Live event for asking questions. I hope you learned some about the Children's Inn at NIH and about the pediatric oncology branch and treatments for childhood cancer.
This was fun. This is the
Yeah.
first time we've done this.
Yeah, that's right.
We hope that it was helpful. Thank you for participating, and please check out both the Children's Inn website and the Pediatric Oncology website for any more questions, and call us
Yeah.
if we can be helpful.
Yeah, thank you.
Bye-bye.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER, produced September 2017.